There have been no new cases of community transmission reported in Australia in the past 24 hours. One historic case has been identified in Queensland, and this provides the link which was missing in the first of the two outbreaks that we've seen in Queensland over the past weeks. This is very heartening progress from a potentially major outbreak. By comparison, sadly, over 685,000 new cases of COVID-19 have been reported in the past 24 hours around the world, and over 11,700 lives have been lost in the past 24 hours to COVID-19, brings the global death toll to over 2.8 million people. I note yesterday we had almost 75,000 COVID-19 tests carried out in Australia, and a huge thanks to everybody who has come forward for testing over the recent days, and especially to people in Queensland and in the north of New South Wales. Australians know how to respond when we have a crisis like this. As a consequence, as Acting Chief Medical Officer, I have removed the Commonwealth hotspot definition for the Greater Brisbane area as of 11:59 p.m. last night. However, Commonwealth support for asymptomatic testing in the community and support for residential aged care facilities continues. As at midday yesterday, we had reported that Australians had received over 750,000 doses of the COVID-19 vaccines. This includes 74,000 vaccines delivered on Wednesday alone, which is a record for the national COVID-19 vaccination program. This includes over 425,000 doses of the AstraZeneca vaccine, with over 133,000 doses of this vaccine having been delivered to people aged under the age of 55 years. We will update these figures further over the weekend once more data is received and collated from around the country. However, we know that well over 750,000 doses have now been administered. The rollout continues in residential aged care, with the residents of 881 aged care facilities having received at least one dose, and the residents of 312 facilities having received both doses. What we've seen is a tripling of vaccinations in the last 2 weeks, and I thank the tens of thousands of Australians who are involved in the rollout of the COVID-19 vaccines, and a special thanks to the many general practitioners and practice nurses who have joined the national program over the past 2 weeks. As you know, Australia's voluntary vaccination program is currently utilising two vaccines, the Pfizer vaccine and the AstraZeneca vaccine. Over the coming months, we expect to also add the Novavax vaccine, and we have the capacity to order doses of other vaccines through our membership of the international COVAX facility. You may also be aware of reports that a small number of people, predominantly in the United Kingdom and in some countries of Europe, have presented with a rare clotting disorder following vaccination with the AstraZeneca vaccine. At this stage, it is still not clear whether this condition is related to the vaccination, but further urgent investigation is underway in the United Kingdom and in Europe. Members of the Australian Technical Advisory Group on Immunisation, ATAGI, the Therapeutic Goods Administration, the TGA, and the Australian Government Department of Health met early this morning with technical advisory experts and regulators in the United Kingdom to discuss the AstraZeneca vaccine and reports that they've had there of clotting disorders, and additional discussions are planned for the coming days. One probable case of this clotting disorder has now been reported in Australia overnight, and we're taking this very seriously. This case is currently being investigated by the Therapeutic Goods Administration, and a meeting will be held tomorrow morning of the TGA Vaccine Safety Investigation Group, which will examine this report and determine whether it could be linked to the AstraZeneca vaccine. As throughout the whole of the COVID-19 pandemic, in Australia we've relied upon our medical experts for advice and guidance to ensure our response to COVID-19 and to support a safe and effective vaccine delivery program. The Australian Technical Advisory Group on Immunisation, ATAGI, in conjunction with our independent regulator, the TGA, They've been monitoring the reports from overseas of these possible clotting disorders occurring 4 to 20 days after vaccination, including the condition known as central venous sinus thrombosis, and they're closely engaged with international colleagues in these discussions. The European Medicines Agency and the UK Medicines and Healthcare Products Regulatory Agency are investigating these reports. Investigators have not at this time confirmed a causal link with the AstraZeneca COVID-19 vaccine. However, the investigation is ongoing. Central venous sinus thrombosis is a very rare disorder that has not previously been known to be associated with vaccination. However, it has been noted as a complication of people who have contracted COVID-19. No cases of central venous sinus thrombosis have been reported in Australia to date in the time period of concern following vaccination, that is within 4 to 20 days. In response to these discussions and to the case which we've seen reported today, ATAGI has today released a statement to support health professionals in responding to any instances of clotting disorders following vaccine administration. In addition, a statement has been released for anyone receiving or considering receiving vaccination, and the Therapeutic Goods Administration has also released a statement. These statements are available through health.gov.au. The advice from ATAGI has been discussed at a meeting of the Australian Health Protection Principal Committee, the AHPPC, which I chaired earlier this afternoon with the Chief Health Officers of each of our states and territories and our expert advisors. It's this advice that I wish to share with you now. People who have received either of the COVID-19 vaccines should be aware of the common side effects, which include fever, sore muscles, tiredness and headache. These symptoms usually start within 24 hours of receiving the vaccine, and they usually last for only 1 to 2 days. These side effects are expected and are not of concern unless the symptoms are severe or persistent. The side effect that concerns us most is the risk of a severe allergic reaction called anaphylaxis, which usually occurs a very short time after vaccination and which is common with several other vaccinations. And this is why everyone receiving a vaccine is required to stay and be monitored for 15 minutes after the vaccination, or for longer if they have a past history of serious allergic reactions to vaccines. The reports from overseas of rare clotting disorders have occurred later than this, between day 4 and day 20 after vaccination, and have generally caused severe symptoms requiring hospitalisation. People should be particularly alert to severe persistent headaches occurring 4 to 20 days after vaccination, and which are different to the usual pattern of headaches that people may experience at other times, and which do not settle with paracetamol or other over-the-counter painkillers. If you receive the AstraZeneca vaccine and you experience symptoms of severe persistent headache or other worrying symptoms 4 to 20 days after the vaccine, you should seek medical advice as soon as possible. Anyone attending their general practitioner or a hospital should let their treating doctor or other clinician know the details of which vaccination they've received and when.